Hi, Mark at Physical of Eversville. Today I want to talk about pain, and if you get pain, one way of considering what you need to do about it. So let's talk about knee pain, for instance. So what I want to say about that is, when a patient comes in with knee pain, that's obviously where it hurts. They've been looked at. They point to a spot on their knee, so maybe in front or on the side they have knee pain, and doctor looks at the knee, feels around, and says, go to physical therapy and strengthen your knees. What I want to suggest to you is that where your pain is does not always mean that's where the problem is coming from. So you may be having knee pain, but the problem is being caused by a hip or a stiff ankle. So what you need to look at, number one, is you want to look at the painful joint, but you also want to look at the joints above and below that. Because if they're not functioning correctly, that could cause a problem somewhere else down the line. So if your foot or ankle is stiff, or not moving correctly, or not using good mechanics, that can wear out your knee. If your hip doesn't move correctly, or if the mechanics that you happen to be using aren't good, the knee can take the hit. The knee really is stuck between your foot and ankle and your hip, and it's only going to go where they allow it to. So using this example, you need to have the foot looked at, you need to have the hip looked at to make sure there's not a mechanical issue there. Now with this kind of thing, I'm not talking about trauma, because if you get banged in the knee or somebody runs into you, you fall on your knee, that's a whole different thing. The kind of pain I'm talking about is the kind that you wake up in the morning and you say, my knee hurts today, but I don't know what I did different. Typically, you have been doing something wrong, and finally it's caught up with you and your knee breaks down. So keep in mind that where you have your symptoms does not always mean that that's where the problem is coming from. So make sure that you're getting fully evaluated and other joints above and below are being looked at just to rule them out as a possible cause of your pain. Because if you don't correct where the cause is coming from, all you're going to be doing is treating a symptom, and you're not ever going to get totally better. If you have other questions, contact us at physicalofersville.com.